Hello, everyone, and welcome to Inside Ascension River Park. Your health, our mission. I'm Eric Paul, president of Ascension St. Thomas River Park Hospital. Each month, we'll introduce you to outstanding physicians and healthcare professionals serving our community while discussing new technology, new services, and important health topics that affect you and your family. Today, we're highlighting one of the most significant investments our hospital has made in recent years, the new GE Revolution Apex CT scanner. This remarkable technology is transforming how physicians diagnose heart disease, stroke, cancer, and many other conditions. Joining me today is cardiologist Scott Rising. Dr. Rising, welcome to the program.
Thanks, Eric. It's an honor to be here. I'm excited to talk about how advances in cardiovascular imaging are changing the way we care for our patients here in Warren County.
Yeah. So, Scott, before we talk about the CT scanner, I'd like our listeners to get to know more about you a little better. Your interest in heart disease actually began long before medical school. Tell us about that.
Sure, I'd be happy to share that story. Besides my parents, there are three men that had a huge influence on my life. The first was my grandfather. He died after his sixth heart attack. He was the first person that I loved and the first person that had an encounter with coronary heart disease. So that was kind of a wake-up call for me. I would have done nearly anything to have prolonged his life, and I wondered what could have been done to prevent so many heart attacks. In many ways, that question stayed with me and shaped the rest of my life.
So that's what led you into medicine?
It certainly planted the seed. As I learned more about heart disease, I became fascinated by the work of Dr. Dean Ornish, which was back in the late 70s, and others, who were showing that nutrition and lifestyle could significantly influence coronary heart disease. That led me to Cornell University, where I earned a degree in nutritional sciences. From the beginning, I wanted to understand why coronary heart disease developed and what we could do to prevent it.
So after Cornell, I know you trained at the Mayo Clinic, and then you completed your cardiology fellowship in Texas at Texas Techs, right? The Red Raiders?
Absolutely.
Originally, though, your career was headed in a different direction.
That's right. Like many cardiology fellows, I planned on becoming an interventional cardiologist. I love doing procedures, and restoring blood flow to a totally blocked artery during a heart attack literally saves a life. It's one of the most rewarding experiences in medicine. However, during that second year at Texas Tech, I listened to a lecture that changed my career.
Oh, really? Tell us about that.
The speaker was Dr. Antonio Gatto, one of the world's leading preventative cardiologists. He gave a lecture about lipoprotein a, or Lp(a), which is a genetically inherited cholesterol particle that significantly increases the risk of premature cardiovascular disease. It was one of those rare moments in medicine where a single lecture completely changed the way I thought. As much as I enjoy procedures, I realized that the best heart attack is the one that's prevented from happening. I left that lecture and changed my career path. Instead of pursuing interventional cardiology, I chose invasive cardiology with a strong emphasis on prevention. That decision has shaped every patient I've cared for over the past 17 years. To this day, I routinely screen patients for Lp(a) because I never want to miss an opportunity to find somebody that has increased risk before they have their first heart attack.
Wow. That's actually an interesting perspective because you've actually practiced on both sides of cardiology. You've spent, sounds like, years performing cardiac catheterizations and treating advanced heart disease, yet you've become known for your passion for prevention.
Cardiac cath remains one of the most important and life-saving procedures in modern medicine. When someone's having a heart attack, there's absolutely no substitute for a cardiac cath. But if we can identify disease years earlier and help someone avoid ever needing that procedure, I think that's even a greater success. The one message that I hope to communicate today is that the best heart attack is the one that never happens.
I agree with that. So I know you've spent 15 years caring for patients in Cookeville before joining us here at River Park Hospital this year. Why make the move to Warren County?
Cookeville is always going to be part of my story. I built incredible relationships there for those 15 years, and I'm grateful for every one of them. Warren County is similar in a community vibe where I can get to know the referring providers and the patients similar or even better than I did in Cookeville. I saw an opportunity to provide sophisticated cardiovascular care and help patients stay local rather than drive to Nashville, and that motivated me to make a change.
All right. So, what have you enjoyed most about this new chapter?
Honestly, it's how quickly I felt welcomed and supported, literally from day one. I'm already seeing patients return for follow ups and beginning to meet their families. It's fun to see who's related to whom and who's friends with who. That continuity and that trust is what I care most about in medicine. I'm looking forward to building long term relationships right here in Warren County.
Very good. So, actually, Dr. Rising, that brings us perfectly to our next topic. River Park has made a major investment in this new GE Revolution CT scanner, right? And as someone who has spent years performing cardiac catheterizations and caring for patients with heart disease, what really excites you most about this new technology?
What excites me most is that we're entering a new era in cardiology. For many years, we inferred that heart disease was present based on blood flow abnormalities, symptoms, or risk scores. Today, with this advanced imaging, we can actually see the plaque itself, often years before it develops into a heart attack or causes symptoms. And that changes everything. It allows us to diagnose the disease earlier. It helps us make better decisions. It helps us determine who truly needs an invasive procedure and who can we treat comfortably with lifestyle changes and medications, not only comfortably, but safely. Most importantly, it gives us an opportunity that patients never had before, which is to change the course of the disease before it changes the course of their lives.
All right, very good. So, after the break, we're going to take a closer look at this remarkable new CT scanner and discuss why cardiologists around the country are becoming so excited about the coronary CT angiography, how this technology is improving patient care, and what it means for the future of cardiovascular medicine. So, stay with us.
Been turned down for a car loan? Struggling to get approved? Don't give up. Come see the team at Reddick Brown Ford. We believe everyone deserves a second chance. Our financing experts work with all types of credit to help get you behind the wheel fast. Make the short drive down Highway 55 to Reddick Brown Ford and drive home approved.
Welcome back to Inside Ascension River Park. Before the break, Dr. Rising, you said cardiology is moving from inferring heart disease to actually seeing it. What did you mean by that?
For decades, much of cardiology is focused on the consequences of coronary plaque rather than the plaque itself. The stress test essentially asks, is there enough narrowing to restrict blood flow to the heart muscle? That's important because it generally identifies the consequences of more advanced disease. This new imaging technology with the coronary CT asks a different question. It asks, what do the coronary arteries actually look like? It allows us to see the disease itself and to identify plaque when it's mild, moderate, or severe, often before it's even causing an abnormal stress test or symptoms. I think of it as seeing smoke before a forest fire starts. If we can identify coronary disease earlier, we have an opportunity to treat it before it progresses to the point of causing symptoms, a heart attack, or the need for a procedure.
Okay. Sometimes I take for granted people know what a CT scan is, but for many listeners, they may not exactly know what a cardiac CT scan is or how it is different from an X-ray or an MRI. So what should patients expect?
Yeah, that's a good point. A CT scanner is very different. It combines hundreds of x-rays into a detailed 3D picture. So unlike an MRI, there's no magnet, there's no long tunnel, which is what makes people claustrophobic, and most scans take just a few minutes. What makes it remarkable is the heart never stops moving. Imagine trying to photograph someone running across a gymnasium with an old disposable camera that you've got to wind with your thumb. You'd be lucky to get one blurry picture. Now imagine a paparazzi doing that same task. You'd get literally hundreds of photos that were crystal clear despite the motion. That's essentially what a modern cardiac CT has become. It captures a beating heart with extraordinary detail, and for the patient, it's painless. They go home later that same day.
Okay. So, Dr. Rising, what makes this new Apex machine different from the previous generation of scanners?
Speed and image quality are better with the new scanner. Faster image acquisition means less motion artifact. It also provides better visualization of the coronary arteries, even in patients with an irregular heartbeat, such as atrial fibrillation, or patients that have a baseline fast heart rate. It also provides, it's a better image quality that allows us to make better decisions. And that's really the bottom line. If you've got better information that you're working with, then it provides better patient care.
Okay. So, here's I'm not a clinician, but here's something I've always wondered. So why do some people have heart attacks even after a normal stress test?
That's one of the most important questions in preventive cardiology, and the answer comes from something called Glasgow remodeling. Early plaque doesn't usually grow inward into the artery, causing luminal narrowing. It grows outward, and the artery actually enlarges to accommodate that early plaque. Blood flow can stay completely normal for years while there's substantial plaque that's quietly building within the artery wall. That's why someone can have a normal stress test, remain clinically asymptomatic, and still have significant coronary heart disease. A stress test answers is blood flow reduced due to a severe blockage, and a CT lets us actually see the disease years, even decades before it starts limiting blood flow.
All right. So, this one here is also new. We recently at River Park created the ability to offer calcium scores. And so we hear a lot about coronary calcium scores. So what exactly is a calcium score, and who should consider having one?
So a coronary calcium score is a quick CT scan without contrast, and it looks for calcium in the coronary artery. If the calcium is present, it tells us that coronary atherosclerosis is already there. Where the test is most helpful is in someone whose risk is uncertain, what we call a borderline or intermediate risk patient. It might be someone in their 40s or 50s with hypertension or moderately elevated cholesterol or a family history of heart disease. The problem is that many cardiovascular events occur in people who were not previously considered high risk. Calcium scoring helps us identify which patients in that middle group actually have evidence of coronary disease. So if the calcium score is 0, it's reassuring. It means we don't see calcified plaque, which confers relatively low risk in the short term, but it doesn't speak to long-term risk, and it doesn't speak to non-calcified or soft plaque. If their score is positive, we've learned something new and very different. Atherosclerosis is indeed present, and generally the higher score, the greater the plaque burden and cardiovascular risk. Once a positive calcium score has moved someone out of that uncertain risk category, I don't keep repeating it. It's already answered the question and moved them out of that borderline risk group into the high risk group. So I think of the calcium score primarily as a risk stratification tool. It helps us decide who in that gray zone needs more aggressive prevention.
Yeah, we started providing calcium scores at the hospital in February, and ever since my wife has been on me to get a test done. So I think listening to that, it sounds like I probably need to get that done. So finding plaque early before it's causing a blockage, that's really the goal.
Exactly. Think of it like seeing smoke before the forest fire starts. That's what early detection gives us. It's a warning, a time to act long before there's an emergency. Coronary CTA detects plaque before the severe obstruction, and that gives us time to act. So the disease is plaque, but the blockage is the later consequence of that disease.
So is it always like the biggest blockage? Like I've heard, if someone has had 70, 80, 90% blockage, is that, what percentage, if you will, causes a heart attack?
So not necessarily the severe blockage is the one that causes the heart attack, and that surprises people. Heart attacks usually come from the rupture of a soft, unstable plaque, not necessarily the largest blockage in the artery. In fact, I've seen some reports that suggest that over half the heart attacks are caused by mild or moderate blockages. That's one of the reasons that artificial intelligence is becoming so valuable in reading these scans.
Yeah, let's talk about that. I know AI is becoming more and more prevalent, especially in healthcare. So how is artificial intelligence improving CT imaging?
So AI is rapidly becoming another member of the healthcare team. It's not going to replace us as cardiologists, it's going to augment us. It helps us measure the plaque volume, the plaque composition, and something called low attenuation plaque, which is that high-risk soft plaque that I was talking about earlier. It tracks progression and regression over time. It improves reproducibility between the scans, and increasingly, it's able to help us predict future risk. We've learned that the amount and type of plaque may matter as much as the percentage of narrowing. Someone can have a modest narrowing, but still carry a significant burden of atherosclerosis, and CT lets us see that. CT increasingly will be able to measure whether the plaque is stabilizing, progressing, or even regressing after preventative therapies. That's a major step toward tailoring therapy to each individual patient. It also helps optimize scan protocols that reduce radiation dose and improve image quality. In the future, it's going to help us identify high-risk patients and personalize those preventative measures.
Okay. Well, so speaking of radiation, has all of this new technology increased the dose patients receive?
Actually, it's usually the opposite. Modern CT scanners frequently produce better images at lower radiation doses.
So can you give us an example of how this new scanner actually changed patient management then?
Actually, there's a good example that just happened this past week. I was consulted on an inpatient for pre-op cardiovascular evaluation, and the patient was very sedentary, so they couldn't perform enough physical activity to get their heart rate up in order to assess if they had a severe blockage or not. So we ordered a stress test. That stress test looked mildly abnormal, but truthfully, I thought the machine was not giving us very good data because the counts were so low. So I thought it was going to be a small percentage of those studies that could be falsely abnormal, and I recommended a coronary CT angiogram with the new scanner. The new images with the CT showed severe disease in all three major coronary arteries. So the front, the back, and the right side of the heart all had severe blockage, and that completely changed the plan. The surgery was canceled, and we shifted our attention toward addressing the severe multivessel disease the patient had. That's a good example of why this technology matters. It can take an uncertain finding and give us a much clearer picture of the actual coronary anatomy, and sometimes, like in this example, it changes the management immediately.
Well, Dr. Rising, that's amazing actually. But I know you're a cardiologist, but beyond cardiology, who else benefits from this scanner?
Nearly every specialty in the hospital is going to benefit from these better images. Stroke care, trauma, cancer imaging, lung disease, orthopedics, emergency medicine, surgical planning. It's truly a hospital-wide investment.
Well, that's good to hear. So as a cardiologist, what do you love most about this technology then?
Honestly, the images are beautiful, but prettier pictures isn't the goal. Better decisions are, and that's what this scanner really gives us in the example like I just cited.
Okay, so does this really replace the need for cardiac catheterizations then?
No, definitely not, and that's an important thing to distinguish. CT does not replace cardiac catheterization. It makes sure that we have the right patients to undergo it at the right time and for the right reasons. Cath remains indispensable for heart attacks and severe disease. CT just simply helps us make sure that we're using that technology more wisely.
Okay, so I know you're new to Warren County. So having this technology then, Dr. Rising, what does it mean for our community here in Warren County?
10 years ago, these patients would have had to go to Nashville, and now with this new technology, they can stay local.
Okay. So as we head to break, what's the big picture takeaway for someone listening at home?
Coronary CT angiography offers an opportunity to discover plaque early. Discovering early plaque creates an opportunity to change someone's future before a heart attack changes it for them.
All right. So, Dr. Rising, thank you. After the break, we'll discuss what happens once plaque is identified and how early detection creates opportunities to prevent heart attacks, strokes, and other cardiovascular events long before they occur. So stay with us, please.
In a place like Warren County, community means everything. And when it comes to your health, trust goes a long way. Every prescription, vaccine, and interaction is handled with care, combining modern technology with a personal approach so you feel confident in every medication you take. And now with our Test and Treat program, you can get tested and treated for common illnesses like flu and strep right here without the wait. And whether it's inside the pharmacy or the drive-thru, the care you receive is more than a pill or a vaccine. It's those in the community serving the community. It's knowing that the staff behind the counter care about your health and your medication, but most importantly, you. So come to Graves Family Pharmacy, because here we put the care in Warren County's healthcare. Graves Family Pharmacy, caring for Warren County one patient at a time.
Okay, well, welcome back to Inside Ascension River Park. We've spent the last segment talking about how the Revolution Apex CT scanner allows physicians to detect coronary heart disease earlier and with greater confidence than ever before. Dr. Rising, you've said several times that finding plaque is only the beginning. So why is that?
Because information by itself doesn't change patient outcomes. What changes the outcomes is what we do with that information. To me, that's really where the value of this technology lies. The scanner allows us to identify disease much earlier than we've been able to in the past, and that gives us an opportunity to intervene before the plaque progresses, before symptoms develop, and hopefully before a patient experiences a heart attack or stroke. That's incredibly powerful.
Okay, so you got to give me an example.
One of the best examples is a condition called familial hypercholesterolemia, or FH. Most people never heard of it, yet it affects about 1 out of every 250 people walking around in the U.S. That makes it one of the most common inherited disorders in the world. Sadly, we detect and treat very little of it. People with FH are born with very high LDL cholesterol and can begin developing coronary artery disease decades earlier than expected. It's not unusual to see a coronary calcium score for a man in their 20s that's elevated, or women in their 30s that have FH. And those patients feel perfectly healthy. They don't even know they have it. Without advanced imaging or appropriate screening, they may never know disease is even developing. And that's exactly the type of patient where early detection can completely change the course of their lives.
You know, that's remarkable because those are very young people, especially for me. I'm in my 60s, so that's very remarkable.
Exactly. Heart disease doesn't suddenly appear at age 60. It develops slowly over decades. One of the biggest misconceptions people have is that plaque begins when symptoms begin, and that's simply not true. Symptoms often occur very late in the disease process. Our goal is to identify disease years, even decades, before that happens.
All right, so Dr. Rising, once you identify plaque, then what happens?
That's when we begin building an individualized prevention plan. Every patient's different, and every patient has the final authority in their care. So you need to start a conversation with the patient. Some need more aggressive cholesterol lowering. Some need better blood pressure control. Others need help with smoking cessation or diabetes management, nutrition management, weight control, increasing physical activity. The important thing is that we now know what we're dealing with. We're no longer guessing. We're treating a documented disease.
You know, Dr. Rising, one of the things I've heard about you and why we were so thrilled to have you come to River Park was your ability to explain complicated medical concepts in a way that patients could understand. So how do you explain prevention?
I keep it practical. I tell patients, and thank you for that. I keep it practical, and I tell patients that there's 3 major tools we have to reduce cardiovascular risk: nutrition, exercise, and evidence-based medications. Each has the potential to produce a meaningful reduction in cardiovascular events. I encourage patients to think about nutrition like a dial. You don't have to become perfect overnight. Simply begin dialing down foods that increase risk and dialing up foods that decrease risk. Foods that we should reduce would be processed foods, excess sugar, excess sodium, and fatty meats. Foods that we should increase to improve health are poultry, fish, fruits, vegetables, whole grains, so we can eat carbs. We just want to minimize the refined carbs, nuts, not with chocolate, not salted, and beans or legumes. Everyone's going to eat less healthy food at times, but if we lean toward these healthier choices, there's huge implications in terms of health outcomes.
I love my M&M peanuts, so
And Little Debbie's, that seems to be a popular thing.
Little Debbie's, yeah. So, okay, what about exercise?
That's another area where people often underestimate themselves. You don't have to be a marathon runner or live in the gym. Research has consistently shown that even a small daily walk produces measurable benefits. The relationship's almost linear. Doing something is far better than doing nothing. Around 150 minutes of exercise each week provides a substantial cardiovascular benefit, and people that do more get more benefit.
Okay, so I've heard you talk about smoking as far as another topic you discuss frequently.
Absolutely. So smoking is one of the most important modifiable cardiovascular risk factors there is. I often tell patients not to think about quitting as an all or none proposition. Every cigarette that they avoid decreases risk. So if they go from a pack per day to a half pack per day, or a half pack down to 3 or 4, that's a significant reduction in risk because each one of those cigarettes has a risk associated with it. And just cutting back reduces that risk every day, every week, every month, every year. You start multiplying that out, it's a huge reduction in risk.
Yeah. So blood pressure, my wife is always on me about my blood pressure. So talk to me about, blood pressure.
Blood pressure is one of the simplest risk factors to monitor, and it's one of the most important as well. I encourage patients to measure it at home, particularly in the morning before the stress of their day begins, and a general goal is less than 130/80 on that morning reading. Blood pressure affects a lot more than just heart attacks. It influences stroke, it causes heart failure, and it causes kidney disease.
So it sounds like prevention today is much more personalized than it was years ago.
For sure. Today, we don't just simply look at total cholesterol. We evaluate the LDL cholesterol, apolipoprotein B, lipoprotein a, inflammation, diabetes, blood pressure, family history, coronary calcium scores, coronary plaque, and many other factors. You're really trying to get a global assessment of the patient. Medicine's becoming much more individualized. The goal isn't to treat a lab value. The goal is to understand the person that's sitting there in front of you. You got to develop the right plan for that patient. Even small changes, though, when you multiply it across all these different things I just mentioned and others, produces a meaningful reduction in risk.
Okay, so Dr. Rising, given everything we've talked about, family history, cholesterol markers, inflammation, the coronary calcium, who should actually be asking their doctor whether a scan like this might be appropriate for them?
That's a great question, and it's one I'd encourage more people to ask. I'd point first to the patients that have a strong family history of early heart disease, people that have elevated lipoprotein a or familial hypercholesterolemia, like I mentioned earlier, patients that are diabetics, anyone that's carrying multiple risk factors, or patients that have an abnormal or borderline stress test should all reach out to their primary care doc and have a conversation to see if they would benefit from further risk stratification.
All right. So is it fair to say then that technology and prevention really go hand in hand?
They absolutely do. The scanner provides the information, and prevention is how we act on that information. So one without the other is incomplete. Technology helps us identify risk. Evidence-based prevention helps us reduce it. When those two come together, when you have that convergence, that's where we have the greatest opportunity to change lives.
All right. Very good. So after the break, we'll look toward the future cardiology, including artificial intelligence, plaque analysis, and why Dr. Rising believes we're entering into one of the most exciting periods of cardiovascular medicine. So stay with us.
Welcome to Town Talk with Raven and Rob.
Behind the mic, I am Chad Graves.
Hey, Hitchcock.
This is Tennessee True Crime.
Get our toes a-tapping with a song. Makes me want to go down Texas way.
All right, we need to dive into some Main Street Journal news, though, Rob.
Well, let's dive right in. A Florida man.
I think Jerry Lee Lewis was the one that he was late for his own concert.
Was it because of the driver?
I think it was because of what he had in the bottle in his room, probably.
All right, welcome back to Inside Ascension River Park, your health, our mission. We've talked about the remarkable capabilities of the new Revolution Apex CT scanner and how earlier detection is creating new opportunities to prevent heart disease. Dr. Rising, you practice cardiology. Let's do that over again. Dr. Rising, you practice cardiology for many years. Have you ever been more optimistic about where the field is heading?
Honestly, no. I don't think there's ever been a more exciting time to be a cardiologist. When I began my training, much of what we did was react to disease after it developed. Someone developed chest pain, someone had a heart attack, someone developed heart failure. To this day, we're exceptionally good at treating that late stage disease, and those treatments have saved countless lives every day. But today we're entering a new era. Now we're beginning to identify disease much earlier, and that's a tremendous opportunity for patients.
So what's behind that? What's driving the change?
It's really the combination of several remarkable advances occurring at the same time. We've got the convergence of better imaging, better cholesterol-lowering therapies. We've got much better understanding of inherited risk like lipoprotein(a) and familial hypercholesterolemia. And we understand inflammation far better than we did 20 years ago. Our diabetes medications now even reduce cardiovascular events. Artificial intelligence is beginning to improve imaging and workflows. Each of those advances by itself is important, but together they're transforming cardiovascular medicine.
Okay, so let's kind of on that same front then. Artificial intelligence seems to be making headlines everywhere. How do you see AI influencing cardiology?
I think AI is going to become an outstanding assistant for us. It's important to understand that AI is not replacing us. It's helping us become better cardiologists. Today, AI helps us with protocol selection, radiation dose reduction, motion correction so our images are better, and all that helps us have better information for the decisions we need to make. Ultimately, that means that we're going to get better patient care out of it. As it continues to evolve, I believe it's going to help us quantify plaque volume more precisely. It's going to characterize plaque composition. It's going to improve our reproducibility from one scan to the next. And it's going to allow us to monitor the disease to see is it progressing or regressing over time. Eventually, AI won't simply help us see the disease. It's going to help us predict who's likely to have a heart attack years before symptoms ever develop. Imagine being able to tell a patient not only that plaque is present, but whether that plaque's becoming healthier or more dangerous. That's incredibly powerful information.
Yeah, Dr. Rising, listening to you talk, it sounds like to me cardiology is moving beyond simply measuring blockage.
Exactly. For decades, we've focused primarily on how narrow the artery had become, and that's still important. But today we're beginning to understand the plaque biology may be just as important as the plaque size. Not every blockage behaves the same. Some plaques remain stable for many years, and others become inflamed and more likely to rupture and cause a heart attack or stroke. As our imaging continues to improve, I think we'll become much better at identifying those differences. That allows us to personalize the treatment in ways we simply couldn't do before.
Okay. So, you've often said that medicine should place greater emphasis on prevention. What do you really mean by that?
So historically, our healthcare system has done an extraordinary job at caring for people after they become ill. We've become exceptionally good at opening blocked arteries, performing bypass surgery, treating heart attacks, treating heart failure. Those advances have saved countless lives and continue to save countless lives every day. I don't see prevention replacing any of that. I see prevention complementing those things. As our ability to detect disease earlier continues to improve, I believe we have an opportunity and a responsibility to place even greater emphasis on preventing disease whenever possible. Because if we can prevent a heart attack, prevent a stroke, delay heart failure by many years, that's one of the greatest gifts we can give our patients.
Yeah, I agree with you there. Dr. Rising, one thing I've noticed throughout our conversation today is that you keep coming back to families.
Because that's ultimately why this matters. When physicians talk about reducing cardiovascular events by 25 to 30%, those are just numbers. Patients don't live their lives in numbers. They live their lives in birthdays and anniversaries, graduations and family vacations, watching grandchildren grow up, walking a daughter down the aisle. That's what really matters, and that's what we're trying to protect. Every heart attack prevented, every stroke prevented, every sudden cardiac death prevented represents another opportunity for someone to enjoy more of those life's meaningful moments. And that's why I love what I do.
That's fantastic. So before we get to the final message, are there specific symptoms you tell listeners never to ignore?
Absolutely. And this is important. Chest discomfort, even if it's mild or comes and goes, unexplained shortness of breath, passing out, any of the classic warning signs of stroke like sudden weakness, facial drooping, difficulty speaking, these all deserve an emergent evaluation and should be taken seriously. If it turns out to be something less than life-threatening, that's a good thing.
Yeah. So, Dr. Rising, what would you say to someone who's been putting off seeing a physician altogether?
The biggest mistake I see isn't people with severe disease. It's people who assume that they feel fine, so they must be healthy. Heart disease often develops silently over decades. The earlier we detect it, the more options we have to prevent the heart attacks and strokes.
Okay. So if one person listening today remembers only one message from our conversation, what would you want that message to be?
I'd want them to remember that heart disease is often preventable. Don't wait until symptoms develop. Know your numbers. Know your family history if you can. Talk with your physicians. If you have risk factors, don't ignore them. The earlier we identify disease, the more opportunity we have to change its course. The best heart attack is the one that never happens.
That's for sure. Okay, and finally, after everything we've discussed today, what gives you the greatest satisfaction as a physician?
When I was 16 years old and lost my grandfather after his 6th heart attack, I couldn't change his story, but every day I have an opportunity to help write a different story for someone else's family. That's why I became a cardiologist. And that's why I'm so excited about technology like the Apex CT scanner coming to our community. It allows us to detect disease earlier, treat patients more precisely, avoid unnecessary invasive procedures when appropriate, and help people live longer, healthier lives. For me, that's what medicine's all about.
Okay, so Dr. Rising, thank you very much for joining us today. I think it's been a wonderful conversation. And personally, we're proud to have you at Ascension St. Thomas River Park, and equally proud to bring technology like the Revolution Apex CT scanner to the people of Warren County and the surrounding communities. And to everyone listening, thank you for joining us for this first edition of Inside Ascension River Park, Your Health, Our Mission. We'll see you next time, and until then, please stay healthy.